Hello again, and welcome to our weekly COVID-19 updates for Davie County. I'm John Eller, Davie County Manager, and we're joined today, as always, by our EOC members, and they will give you an update of some key things happening in the county today as it relates to COVID-19. And we'll, as always, seek input from any of you and show you how to get feedback to us so we can be responsive to your needs every week. So we'll go ahead and dive in today on behalf of the county commissioners and Assistant Manager Robin West and myself. Thank you for tuning in. We hope you'll find these valuable each and every week as we get you the most recent information. So we'll go ahead and transition into our very first speaker today. Every week we have Mr. Jeff Wallace with us for Davie County Schools. We'll go ahead and get a schools update. Mr. Wallace.
Good afternoon, Mr. Eller. Thank you very much. And group and community, thank you again for this opportunity. Well, we had long awaited for an announcement today from the governor regarding the plan that schools would open in which plan, either plan A, B, or C, in August or on August 17th, which is the scheduled open date for all schools across North Carolina. But we were informed last night, superintendents were informed that the governor would not make a decision about the plan today. He is holding a press conference today at 3 o'clock to provide updates, but my understanding, superintendents have been informed that we will not be told. Now, again, when we were told that information last night late, said be careful because it could change between last night and 3 o'clock. But at this point, we do not anticipate that the governor will share which plan A, B, or C, that the schools across North Carolina will open in starting in August. However, I will assure you all that we have a team together that consists again of staff, parents, administrators, board members, and folks involved that are meeting, and we're planning for each of plan A, B, or C. So we will be ready. And again, I want to continue to share the complexities of plan B. And I keep referencing plans A, B, and C. All of these plans can be found in the reopening schools, North Carolina's reopening schools plans. That if you just Google those, you'll find them. But the plan B, again, plan A is we return to school with some minimal changes and modifications. Plan B is where we open school with 50% occupancy. And plan C is strictly remote learning. Plan B creates a lot of concerns and a lot of complexities of getting kids back and forth, but we do understand the safety and of our kids, of course, and staff, and then our community. But we have a large team that's working together now and making plans for each of the plans, and we will be ready to go. And one other thing, I will give you one final update on our feeding program that I mentioned multiple times, and just again commend our child nutrition director, George Selecki, and his staff. They served just shy of 371,000 meals since March, between March 17th and June the 15th. So absolutely phenomenal job. And we're very appreciative of him. And the summer feeding program is in place now, not quite as the largest scope that it was prior to, but we are well into the summer feeding program. And that is, and again, if anyone has questions, please reach out to us. Community, we're working hard to serve our children and our families. And please, if you have questions or input, we'd love to hear that. And John, that concludes my comments for today, sir.
Thank you, Mr. Wallace. We appreciate you and all that you and your team do for us and our children and families in Davie County. And I know there is a lot of moving parts and variables to these various plans you're having to plan for, not knowing which will be the final version. And so we appreciate all the hard work you put into that and look forward to continue to team with you through that. We'll transition now into our Health and Human Services weekly update. Ms. Suzanne Wright is our Director of Health and Human Services, and she's here to give you her piece of an update. Ms. Wright.
Thank you, Mr. Eller. There are 225 total cases of COVID-19 recorded for Davie County to date. 66 of those cases are actively sick. and one person is currently hospitalized. We've been seeing the recent trips to Myrtle Beach have caused an increase in our local numbers, as have family gatherings. I know we've mentioned family gatherings before on this call, but we continue to see cases as a result of family gatherings on the weekends. I also want to remind people that if you're asymptomatic but test positive, you are still positive. So if you're having only a few symptoms or no symptoms at all, you still need to quarantine and or isolate accordingly. I just want to keep that reminder out there because we've had some recent calls about those. Also want to let everybody know that the website posting frequency for case numbers, that has changed. We're going to do those twice weekly instead of every day, simply because the call volume and the demands of the call center have increased significantly. So time to submit those is limited right now. North Carolina Department of Health and Human Services is working on making a public-facing dashboard with hospitalization data. The data is not there yet. It's there in aggregate form, but they're looking to have that information on the ncdhhs.gov website in about 3 weeks. Also on that site, you can find the cluster information that we've talked about in the past and also the outbreak information. The state is also collaborating with CVS and Omnicare for a one-time COVID-19 testing initiative of all residents and staff in nursing homes. As we've discussed in the past, the nursing homes and long-term care facilities have pretty strict guidelines and have to test more frequently than others, and some have just adopted testing more frequently than others. So CVS is going to be helping out with that. It looks like an estimated 36,000 residents and 25,000 staff in over 400 nursing homes across the state will be tested through mid-August. So I'm pretty happy that CVS will be working to support those efforts. Also, the state has awarded grants to local North Carolina organizations to help address the impact of COVID-19 on the state's Hispanic and Latinx communities. You've probably seen the race and ethnic case numbers that we've presented on our Facebook page as well. We're starting to see those numbers level out, but at one time our Hispanic community was significantly impacted. So we're starting to see those numbers level out a little bit, but across the state, the Hispanic and Latinx communities are getting hit pretty hard with COVID. So glad to see that some funds are being directed to help support disease prevention measures in these high-risk populations. And other than that, I just wanted to state again that the Public Health Call Center is, the demands there are increasing daily. As you see, our numbers continue to increase. So just please be patient. If you call and do not get an answer, someone will call you right back. But just know that that number is staying pretty busy these days. And that's my report, Mr. Eller.
Thank you, Ms. Wright, for all that you and your teams are doing. I know there's a lot of after-hours work going on right now, and we appreciate that very, very much. We'll transition now into our emergency services update. Mr. Brian Bird is with us today. Mr. Bird, turn it over to you.
Okay, thank you, Mr. Eller. Day 114 of the state of emergency. I'm sure everybody's starting to get tired of hearing that, but that's where we're at right now. At emergency services, we're business as usual. We got normal call volumes heading into the July 4th weekend. We've been fortunate to stay at full staff during this COVID-19 emergency. Some of our neighboring counties have had staff affected by coronavirus. They've had some positive cases in their responders. Each time we find out about one of these situations, it just serves as a reminder to us to follow the guidelines and use the tools we provide to keep our responders and our patients safe. As a throwback to one of our previous meetings that we did, it's worth reminding everybody that our 911 center for coronavirus does some extra screening over the phone. So if a person has to call 911, they may be answering a few extra questions that they're not used to. But that's to help us be ready for when our responders get there to know what they're really getting into and if they should be suspicious of a coronavirus patient. Our responders, when they arrive on the scene, you may see them take just a moment or two more to get into the home because depending on the situation, in addition to what they would normally wear for protective equipment, you may see them putting on a face shield and a gown in addition to the mask that they now wear. And lastly, we've got a great group of first responders in the county, but we've been trying to protect them some by holding them back and not having their exposures be as great as they have been in the past. So we're doing quite a few things to try to keep plenty of responders available for us in the county and to keep everybody as healthy as we can. Our fire marshal's office has been especially busy in the past week. They've had several active fire scenes to assist our departments on. They had a rescue the other morning of a motorist down a steep embankment, so we appreciate the work that the fire marshal's office and that our fire departments are doing within our county. At emergency management, we've got an updated Davie County Emergency Operations Plan and the Regional Hazard Mitigation Plan that we just completed, and we'll be delivering those to the county manager this week for his review. We've had a few questions come in to us from citizens around the county asking about the governor's order and about mask use and how to do that. And while we don't get nearly as many calls on that the health department line does, we do get a few, and we've been trying to help folks with that. And you know, other than wishing everybody a safe 4th of July holiday, that's about it for my update today, sir.
Thank you, Mr. Bird. We appreciate all that you and your paramedics and team do for us. We'll move now to our 911 communications update. Mr. Rodney Pierce.
Thank you, Mr. Eller. As a reminder, for general questions regarding COVID-19, such as calls regarding travel, business operations or regulations, religious services, or those questions regarding the governor's phases and plans, should be directed directly to the state information number, which is 211. We don't have that information, and the state utilizes their own network. So 211 would be a quick source to go to for that information. If you do have localized questions, the Davie County hotlines that were posted by Ms. Wright are available. And also, as Mr. Bird spoke of, yes, we are still asking screening questions for calls when they're applicable. That is to ensure responder safety. Screening questions will be asked, so be patient with our call interrogation. These questions are designed to give further insight to assist your needs and better prepare the responders coming to aid you. That's the most from the front lines from the 911 Center, and thank you, Mr. Eller.
Thank you, Mr. Pierce. We appreciate you, sir. We'll move now to our public utilities update. Mr. Johnny Lambert.
Thank you, Mr. Eller. Not a lot of change in utilities. We're still working under the governor's executive order of suspending disconnections and suspending all late penalties for payments that haven't been made. And we're still asking everyone, if they haven't made their payments or if they need help with their payments, to call our office at 336-753-6090 and talk to staff about setting up payment plans. And of course, with some businesses reopening, we're still talking about the flushing of the water in the systems and visiting the CDC site to get all the information they need about the unused water that's still in their system that's been setting for a while, to get some more chlorine and other things back in their system to do away with the taste and odor issues before the reconsumption of normal use of water. And thank you, Mr. Eller. That's all we have today.
Thank you, Mr. Lambert. Appreciate that update. Folks, as always, we ask you every week to get us any feedback you have. If you have particular questions for any of us or certain things you want us to talk more on, please go to this site and submit any feedback for us. We'd love to be more responsive to you. As we say to you always, we're not going to try to repeat the same things every week if we can help it. We'll keep reminding you of some things, but feel free to tune in to prior episodes of this to get caught up on things. But we'll also have speakers on here from time to time regarding topics. We thank Mr. Chad Brown from Davie Medical Center for joining us last time, and we'll have other speakers in the future as well. But with that, we'll conclude this week's episode. I want to thank all the Emergency Operations Center participants for giving us their update today. We appreciate all their hard work, and we thank our community for continuing to come together, help each other, and help us all stay together through these trying times that we find ourselves in. But it's a great place to be in Davie County, and we hope that you find these updates weekly valuable. So until next week, we're going to tune out, and I hope everybody has a great 4th of July weekend, and just be mindful of things we've talked about today to keep you and your family safe. So thank you, and we'll talk to you next time.